Good day everyone, my name is Man A. Pandalanan and I'm going to perform the urinary catheterization. Before anything else, we have to done washing our hands and put some gloves in it just to avoid any microorganisms that may pass by the patient and into the patient. So we have now done gloving. Next is we have to assess the patient's perineal area if it has any obstructions or anything that is swollen, to see if our patient is not enough to do the urinary catheterization. Then, next thing we need to do in our patient is to cover or drape some cloth to her abdomen up to her thighs, just to feel her to be comfort when we do the procedure. Then after that, Then after that, we remove her undies just to see the swollen part, if ever, to her private part. So as you can see, our light in this room is enough to do this kind of procedure, the urinary catheterization. Now we're going to ask the client if she has history before. For example, if she does experience urinary catheterization before. So, na-urinary catheterization ka ba yung pagpasok ng tubo sa sa vagina mo? Hindi pa naman. So, this is her first time. And then, assess the client's ability to cooperate with me. So, as you can see, conscious naman siya. So, nakakausap naman natin siya. And then, assess the working area. And assess the working area as if it is clean or not. And then, assess for an allergy to povidone iodine and or latex. Because we use a latex gloves on her and then povidone iodine for some perineal care. The next thing is that after we remove her undies, we're gonna prepare our materials. We must have some sterile catheter of appropriate size, and then a waterproof pad, sterile gloves, antiseptic solution, the cotton balls, the micropore, the urinary bag, and then some gauze pad or some waterproof pad, and then some urinary collector like a basin or something else, and then a syringe with a 10 ml water. So, right now, we need to assemble our urinary catheterization. I have here a suction catheter because my parcel hasn't yet delivered. So, I have here an improvised urinary catheter, and then this one is an oxygen tubing, but then my parcel isn't here, so I have to improvise. So this one could be the tubing for the urinary bag. So I don't have any urinary bag. Okay. And then This one is my urinary bag. I have a urinary bag because it hasn't arrived yet. So I'm gonna put here and then seal it. It's sealable, as you can see. And then this one is we're gonna lubricate it before we're going to do the procedure into our patient. So it's all assembled with a clean towel, but it's better if you have a waterproof gauze pad for the buttocks of our patient. So kunyari lalagay ko, kunwari lang. And then next is we're gonna do some perineal care for the private part of the patient, wherein we're gonna do is to clean those areas that we're going to insert the urinary catheter. So I have here some improvised tools for this return demonstration be done. So I have here some cotton balls, then put some povidone iodine. So this one is used for the feminine wash, for the female wash. And then we're gonna clean some parts. One stripe only. Next, another one. Another stripe. Next, for the last, we're gonna wipe it. Okay. Next is put some lubricants on our urinary catheter. Here is the lubricant, so we're gonna put some of it. So, for the female, we have to insert it in 1 to 2 inches. We're gonna insert it now. Are you feeling okay? Insert ko na ha. Okay. Hingang malalim. Hingang malalim. Okay. And then, I have here a 10 ml normal saline in a syringe. So we're gonna inject some of it just to see if our urinary catheter is okay or it has no damage. Okay ka lang? Okay, now it's done. It's done for the urinary catheterization. So, iwan ko lang dito. Iwan ko lang to dito. As you can see, I haven't used a tape because my urinary catheterization set of tools in it is comfortable as per our client. So we're done, and then we check the client every hour to see if there's a secretions coming out from her vagina. That's all. So for the evaluation, we have to assess the color, the amount of urine, note for any complaints for the pain on the catheter, and document the procedure done, including all the assessment findings. Because we have to note it, because if any possible underlying conditions that requires appropriate referral and management with the physician, we have to note those, just to make sure our patient is comfortable and able to do so the procedure in a long period of time. And then in order to have accurate date for collaborative management and continuity of care.